Hello, Dr. Sushma. Welcome to National Dynamic Medical Student Summit 2021.
Hello, Dr. Sajjan. Thank you so much for inviting me to speak in this.
Right. It's our pleasure to
How
have
are
you
you doing
today.
today?
All good, Dr. Sushma. Being in the specialty of pathology, right, for all these years, we just wanted to get an insight of the specialty, your life experience in that area, and your views on how the career pathway of pathology is, and what's your view on that particular specialty, and what our students can get out of an insight into what they can look forward in this specialty if they choose this as their career. Okay, so with that, let's
Sure.
move on with
Yeah.
our interaction. First, we would like to know why did you choose pathology as a specialty for your career?
Well, that's a very difficult question, Dr. Sajjan.
Hmm. I
Well,
get that.
honestly speaking, pathology was not my first choice when I
Mhm.
took up the subject. I wanted, like most of the medical students, I too wanted to take up a clinical field because I was under the impression that pathologists just teach in medical colleges and they just sign out some reports which are printed out by the machine.
Mhm.
But due to some circumstances, I took up pathology, and then once I took it up, I realized that pathology is a core branch in medicine, which is
Mhm.
very vital in the clinical diagnostic team.
Yeah.
So basically, pathology deals with understanding the disease processes, and it's very important that you have a deeper understanding of this subject as well as to understand the disease processes.
Yes.
So I found the pathology to be very intellectually stimulating and rewarding. And another reason why a person can choose pathology is because of the diversity in its field. So you can tailor your job to fit your interest or your needs, and while also having a flexible work schedule. So
Great.
I came to know all this only after I joined pathology. So till then, I wasn't aware of any of this. So I wish somebody had told me this before, because that would have made me a lot more interested to take up this field in the first place. So what I mean
So
to say is, nobody told me what pathology was about. So I just blindly took it up. But I am glad I took it up because I feel I made the right decision.
great, Dr. Sushma. So I think that's the space most of our students are, and I think by this interaction, I think they would get a lot of insight into the pathology. Right.
I
So
hope so. I
being
hope so.
got it. So discovering a lot of things as a career when you are already practicing in pathology. What would you say the positive or the pros of taking pathology as a career?
Well, the first and most important part of taking pathology as a career is the wonderful work-life balance that you get with it.
Mhm.
Because generally, pathology is a 9 to 5 job, but it also depends on your workplace setups, like where you're working, whether you're working in a corporate hospital or whether you're working in a medical college or a private lab. So it depends on that. But generally speaking, pathology is a 9 to 5 job. So there are hardly any emergencies and there is hardly any night duty or on calls. So even though the duties might be hectic during your work hours, once you go home, nobody will trouble you. So nobody is going to wake you up in the middle of the night saying, you have an emergency and you need to come to the hospital right now. So once you go home, you can be at peace. So I think that that's one of the most important pros of taking pathology as a career as such.
Mhm.
Second is the endless variety of work that you get with pathology. So you have different branches there. You have histopathology, you have cytopathology, hematology, clinical pathology, forensic pathology, blood banking. So depending on your likes, you can further pursue what you want later on or choose to work in that particular field of pathology. Third is you get the best of both worlds with pathology. So you can deal with the diagnostic aspect in the hospital, or you can go in for the academic field in the medical college. So you get both. So you can choose to take both, or you can choose to take either of those. And for people who are interested in research, there are a lot of wonderful research opportunities in pathology as well. So all in all, you have a number of advantages of taking pathology as a career.
Great. So with that, let's look into what are the cons or any disadvantages of being a pathologist?
Well, Dr. Sajjan, actually cons, when you talk about cons, it's usually relative. So the same thing, some people might take it as a disadvantage, but the others might take it as an advantage.
Okay.
So we know that pathology is a field where there is limited patient interaction. Unlike what people think, pathology is not a non-clinical field completely. So you have limited patient interaction where you do procedures like fine needle aspiration or bone marrow aspiration. So you do have limited patient interaction, but some people might take it as disadvantage because when they think of being a doctor, for them being a doctor is dealing with patients on a day-to-day basis. So that might be taken as a disadvantage by many, but it's also a boon in many circumstances.
Right.
So, and the second one is you don't get to be in the limelight being a pathologist because you are mainly behind the scenes. So if you ask anybody in the general public, like, do you know what a pathologist does? They will ask, pathologist who? So basically nobody knows, or people are unaware of what a pathologist does, or even that a pathologist exists. So that might prove to be a little worrisome sometimes because the number of hours of work that you put in and the amount of hard work that you put in, and finally nobody knows you. So that might be a little demotivating to some people. And sometimes your own colleagues from different departments, they're like, what work do you have? You don't have any work. So all you have to do is just sign out some reports which are printed out by a machine. Like I too thought the same thing initially, but then I realized how wrong I was later on. So that might be a little demotivating to some people because some people need constant encouragement or motivation to work in a particular field.
Got that.
Apart from that, some people find it boring to sit in front of a microscope the whole day, and some people might find some procedures in pathology a little uncomfortable, like dealing with some chemicals like formalin might not be very comfortable for some people. And one last thing is that pathology is a dependent branch, and there is a lot to read, a lot to keep yourself updated with. So these might be some of the disadvantages that I can say from what I have seen.
Great. So we could look into disadvantage or could be some of the challenges in similarly which you could interpret that. Got that. So now after looking into
Yes.
the pros and the cons of this particular subject, for whom do you suggest what type of a student would be an ideal choice for?
To answer that question, it's always better to have a checklist. So, is a student giving a lot of attention to detail? Do they like to read and study a lot? Because there is a lot to study in pathology, just like in medicine as such. So, any candidate who is okay with spending a lot of time in front of the microscope. So, once you join pathology, stethoscope is not your best friend, microscope is your best friend. So if a student is okay with spending a lot of time in front of the microscope, that is one. Second, are you okay with not having a lot of patient interaction? So you're okay with limited patient interaction. Third is, do you want a well-planned day? So, or do you want like an adventurous day where you're dealing with patients continuously? So if you want a well-planned day, then yes, pathology is the field for you. Apart from that, the candidate should not mind not being in the limelight.
Mhm.
most of the time. And lastly, if the person wants a very good work-life balance, then if you have told yes to most or all of these points in the checklist, which I told, then yes, go for pathology.
Great. That was well structured and systematic. I think hope that would add a lot of value to the students. Got that, Dr. Sushma. So, looking into the pros, cons, and the checklist which you already mentioned. So now the student is interested in taking pathology. What would be the future would look like? What super specialization would be available for these students in pathology?
So you can either take up DM in
Mhm,
pathology. So you can take up a DM in either hematopathology or clinical hematology, histopathology, neuropathology, genetics. So many options in DM as such.
mhm,
Or you can go in for fellowships, which usually range from about 6 months to 2 years.
mhm,
So it can be in GI pathology or oncopathology, hepatobiliary. So a lot of options there as well. Apart from that, you can also do PhD,
mhm.
like in immunology or transplant, or go in for DNB in clinical pathology. So these are some of the options which are available to you for super specialization after MD in pathology.
Great. So that means there are a lot of options which a student can explore.
Yeah,
Right.
yes, definitely.
So now, with all these career opportunities again, that is super specialization, and also after MD pathology, what would the career opportunities in India after being an MD pathology?
Well, there are a couple of options in India. So one is you can be associated with the medical college. So
Hmm.
you work in a medical college as well as the hospital associated with it. So in the
Yeah.
medical college, you are a professor, and in the hospital associated with it, you can be a consultant pathologist. Second is you can work as a consultant pathologist either in a government setup or a private hospital.
Hmm.
Third is again a consultant pathologist in a private lab. And other than that, you can open your own lab, but yeah, it will need a lot of remuneration as well. And lastly, you can also work as a blood bank officer in a hospital. So these are some of the career options that you have when you think about career options in India.
Great. So now I also know that you have planned to move to UK, and you have got an opportunity in UK. I think
Yes,
you'd be
that's
the
right.
right person to ask what are the opportunities available for the pathologist in abroad.
Okay. Well, firstly, yes, I will be moving to the UK soon. And well, actually, the career opportunities abroad will mainly depend on what you want. So, whether you want to be in diagnostics, whether you want to be in the teaching field, or whether you want to go in for research. So, if you want diagnostics, so you have these fellowship exams which you can give, FRC path, or you have these licensing exams. For example, in UK, you have the PLAB. So, once you give these exams, you get your registration. So after you get a registration, you can apply for jobs as a pathologist and work as a pathologist in some countries. So like UK or Singapore or the Middle East. And second is if you're interested in research, you can go in for research fellowships in different universities all over the world. Or some of the offshore American universities also recognize our MD degree. So you can teach in universities there as a professor. So these are some of the career options, but there are a lot of other career options as well where you can pursue PhD and then go into the research field in depth.
Right. So that opens up, I think, a lot of windows and doors which they can look
Yes,
into and
definitely.
explore. Got it. So going ahead, I think one of the key area where most of the students would be interested is what would the earning potential in this particular field?
Um, well, I would like to answer this question a little bit differently because
Uh-huh.
when you say potential, there is a lot of potential in every field that you work in because
Right.
ultimately it depends on how much work you put in, how many hours you work, where you're working, which type of setup, where in the world or where in India. So it depends on a multitude of factors. So, but I can give you a general idea of an average salary of pathologist. Pathology can expect to earn anywhere between 60,000 to 1 lakh per month in a medical college in India. So it can vary. It can go higher. It can go lower sometimes depending on what post you join as.
Yeah.
So that's just an average salary that I'm talking about. But the how much you can earn will ultimately depend on how much work you put in. Because if you are doing private practice, it will depend on the number of cases that you see or report. So the more the number of hours, the more the number of cases you put in, your earning can go proportionally high. And also when you work abroad, again, the earning potential can be still higher. And it depends on if some medical colleges also let you do private practice alongside. So when you have both, so again your earning potential goes higher. So I hope I've given a vague idea of how much a pathologist can earn, because I cannot put a cap on how much a pathologist can earn, because you can uh, choose how you work and how much you want to work.
Got it. Right. So, Dr. Sushma, you already touched upon work-life balance. Could you just give
Mhm.
us more detail or your insight on how is this work-life balance in this particular career?
Well, according to me, the work-life balance in pathology is excellent.
Mhm.
Like I said, usually in medical colleges, the job is from 9 to 5. So even though the work from 9 to 5 will be very hectic,
Mhm.
but once you get out of the hospital, nobody is going to trouble you.
Yeah.
So there are hardly any emergencies, no night duties, no on calls, holidays are free, generally speaking. But again, it depends on the setup you're working in. So you basically, once you go home, nobody is going to trouble you or wake you up in the middle of the night telling, see, you have got an emergency, come to the hospital immediately. So
Yeah.
that way you get to spend quality time with your family, or you get enough time to pursue your hobbies as well. And you also get your annual leaves, because there is some other pathologist who can cover up for you when you are not around in the hospital to do the job.
Right. Great. So that sounds very much interesting. And I think those students who will be looking for more of work-life balance and not taking
Mhm,
being more in the part of family, and I think that would be one of the area where
mhm.
I think pathology they could look up to. Okay. So coming into the future of pathology itself, what do you think? How is the future of pathology going ahead?
Well, Dr. Sajjan, pathology is a subject which will always be in demand. So a
Mhm.
pathologist will always be in demand because it's a dependent field.
Mhm.
So with the newer advances in technology and newer advances in the medical field as such, pathology is having a very good scope in the future. So with respect to career, I have already told you that you can associate yourself with the medical college, or do do your job in the private hospitals or private labs. But when you open, if you open your own lab, so you can open up a highly specialized lab like oncology or immunology, which will have very high demand in future.
Mhm.
So because pathologists are always needed, I feel the scope of pathology in future is very good.
Great. Yeah. So I think that's gives an idea on what a student could look forward. I think you touched upon both on medical college, and also if not there, they can also have their own private setup and run the
Mhm.
entire career through that process. Okay. So with that, let's move on to the very interesting part. Could you just share the experience in the your experience in the field as a pathologist? How was that? And how did you manage to,
Um,
with all these years you've been a pathologist, okay, in a medical college and in different capacities, and now you have moved, your plan, you have given your exams and moving to go to UK. Then how did this happen and what's there for? Give us an insight into
well, like I said, I pathology was not my first choice when I actually selected this seat after my MBBS. So I took this purely by accident or chance, you might say. So once I did my 3-year post-graduation in pathology, that is MD in pathology, I started working as a assistant professor in a medical college. So I used to work as a consultant pathologist in the hospital side, dealing with the diagnostic aspect, as well as work as assistant professor in medical college side. So, well, in the hospital, my usual work was like in the morning 9 to 5, where I diagnose cases, write out reports, and I was learning something new every day. So sometimes there would be some complex cases, and each day would be different from the previous day.
that.
So in the medical college aspect, I could keep in touch with my with the basics, and because I was teaching medical and dental students, and I could interact with the students on a day-to-day basis. So, and I was also doing research side by side, attending conferences, publishing papers, or presenting papers. So basically, unknowingly, I was building up my CV in a good way. So I'm being associated with the medical college. So I was always interested to explore opportunities abroad. So I did get a chance to do observership in pathology in previously as well. So I could see that in what other way you can look at pathology when I went there. So when once I saw that, I thought, okay, why not try to pursue my field abroad? So then I gave my licensing exams and then applied for jobs in pathology in the UK.
Mhm.
So basically, like I said, you have a variety of options when you join pathology, depending on what you want. So I also wanted a good work-life balance. So that's what I finally got.
Great. So,
So that's my story.
wonderful, wonderful. So we'll be now, exploring the world abroad and seeing how the pathology runs there and get a better insight and
Yes,
knowledge and expertise. We wish all the best
yes.
in that journey, Dr. Sushma.
Thank you.
Right.
Thank you so much, Dr. Sajjan.
Yeah. With that, so let's look into the challenges. What challenges have you faced in this particular pathway?
Well, let me quote my one of my professors. So she
Mhm.
always told that diseases don't read textbooks, so they don't follow rule books. So not all cases that we see in the hospital are typical, because in the textbooks they will give that this disease has this. These are the features. So if you see these features, it is this. You should diagnose it as this disease. But diseases usually don't follow all the rules there. So there are so many atypical cases, so many cases which you cannot diagnose based only on that. There might be some features, there might not be some features. So that I felt was one of the most important challenges pathologist faces. So in spite of taking seniors' opinions or talking to the clinicians or doing some special tests, sometimes it is very difficult to arrive at a diagnosis. So that is one of the challenges that I personally felt as a pathologist you might have to deal with. But with your senior colleagues around, I think that shouldn't be much of a problem. Second is most people are unaware of what happens to a specimen or a sample once it comes to the pathology lab, because basically nobody has pathology postings when they are in MBBS or internship. So they don't have much of an idea of what happens once the specimen or the sample or the patient is sent to the lab. So as soon as the patient is sent or the specimen is sent, usually everybody will just start asking within half an hour, like, is the report ready? Is the report ready? Is the report ready? So we find it hard to explain to them why it is taking the number of days it is taking, because people are unaware of what goes on in a pathology lab. So that can be a little challenging because they think that we are delaying the report, but actually that's the turnaround time which is actually needed for the specimen or sample to be reported. So that is the second challenge that I felt as a pathologist. Third is, I feel that pathology needs to be more integrated with the clinical sciences. And lastly, pathology needs a lot of skill and expertise. So you need years of experience to master this field. So initially, a freshly passed MD in pathology might find it a little difficult without seniors' guidance to go about reporting cases.
Great. So basically, you're telling pathology is a subject which requires continuous learning. Okay, learning and
Yes,
unlearning, because you've been stick to this textbook. So you need to unlearn some things and learn
exactly.
with the experience of the seniors around. Great. So we got the
Yes,
challenges.
and
That's
if
great.
you don't,
Yeah.
yeah, and if you, it's a field where you have to continuously keep on reading. So if you don't read for a while, you will be outdated in 5 years.
Got that. That's I got that. Right. So with that, we would like to know, because as you mentioned, initially you were a bit skeptical regarding pathology, and you're not sure uh, what's there in pathology.
Mhm.
So now, being in the field,
Right.
what do you see? What do you feel the best part of you taking pathology as a career?
Well, honestly speaking, I'm very happy with my field
Hmm.
because I am a kind of person who does not enjoy the adrenaline rush which comes with dealing emergency cases in the casualty.
Hmm.
So I'm not a person who is very comfortable with hearing the ambulance siren and patients rushing in with the emergency cases. So the best thing about pathology for me is that I hardly have to deal with any emergency situations. So I can take my time with each case and patiently report it. And if I have any doubts, I can refer back to the books and then consult with my seniors and take my time and give a proper diagnosis. So that is the best thing that I like about pathology.
Got that. Right. So that we could see the happiness you have in your face. That's the best part. We got that. Without
Yes.
you expressing that. I got that. Okay. So now we at the end, like what's your guidance for the young upcoming doctors for choosing this as their future career?
Well, pathology is a field which has both clinical and diagnostic work in the hospital, as well as it deals with the academic aspect in the medical college. So I would advise students not to go by the popular misconception that pathology is purely non-clinical, because there is patient interaction, there is patient care, there is the diagnostic aspect which is related to pathology. So that is one thing I want students to keep in mind, because general notion is that pathology is non-clinical. You don't get to deal with patients at all, which is not true. Second is pathologists are always needed, and there are a lot of career options to choose from. So students should not hesitate to take up pathology as their career. Third is, it's a very intricate subject, requires a lot of reading. So be prepared to give in your best, because like I said, unlike the popular misconception, pathology is not easy. My professor always says pathology is not easy. Even after so many years of experience, she's one of the top pathologists here, but she says that pathology is not easy. It's very difficult, even with these many years of experience. I will say this. You need to keep updating yourself. You need to keep studying and putting in a lot of sincere effort. And but having said that, it will be a very fulfilling field for you, because with every case that you diagnose, by the end of that day, you will feel like a detective who has solved a case. So with each case that you diagnose, you will get the feeling that you have been like Sherlock Holmes or something. And lastly, if you're okay with limited patient interaction and you want the diagnostic as well as academic aspect of medicine, and you want a good work-life balance in spite of doing all this, and you don't mind the microscope being your best friend instead of the stethoscope, then go for pathology. That's all I have to say.
Wonderful, wonderful. I think that really hits the core. It makes completely sense, and I think there will be a lot of students who will be very inspired by the way you have structured, the way you can choose the specialty itself. That's one. And secondly, now I see, for me, the entire journey which you have taken is very inspiring. Being from very spectacle, being a pathologist with, as you also mentioned, like a lot of studies, a lot of upgrading, and a lot of confusion in the diagnosis, to now clearing your entrance and moving towards UK. That's a wonderful path which you have taken, and really very happy for you. We are really inspired by the career path which you're taking. Hope to see you, in a bigger position and a better knowledgeable person, expert from UK when you come back to India. All the best, Dr. Sushma, and thank you so much for being here today.
Thank you so much for the inspiring words, Dr. Sajjan. It was nice talking to you.
Isn't this valuable to know the career pathway of a specialist? Hear from experiences of 50 plus consultant doctors from across India. Get an insight into 22 plus medical specialties and make an informed career decision which will shape your future. Join India's first of a kind online medical specialty summit exclusively designed for medical students. Visit our website drsajjanacademy.com to know more. Don't miss out on this golden opportunity.